Hey, everybody. Welcome to another edition of Healthy Happy Hour. Yes, we are back again. And usually we will give you all a Healthy Happy Hour once a month, but we just got a lot of friends and we got a lot of information to give you all before this year is over. So you're going to get more Healthy Happy Hours, or maybe two or three Healthy Happy Hours a month for the remainder of the year because we have a lot of information that we want to make sure we get to you all, and we don't really want to wait on it. So uh, you're welcome. We're going to inundate you all with information through our Healthy Happy Hour series. And of course, originally Healthy Happy Hour occurs every third Thursday of every month. And Healthy Happy Hour originally is an event that is set for in person so people can come to the venue we have to experience the presentation. But because of COVID, we had to make our Healthy Happy Hours digital. But we're looking forward to being able to come back face to face with our Healthy Happy Hours. And if not, still have our digital platform. So today will be no exception. And today we will be talking about health insurance. And this is actually, I believe, our first person to return as a guest for our Healthy Happy Hour. So this will be great. So the last time Mr. Bowman was on Healthy Happy Hour, he was representing a specific health insurance company, but now he's representing himself. So Mr. Bowman has spent his life using his personal and professional experience to help clients understand healthcare and provide them with the resources so they can make informed decisions for what is best for them. After working exclusively for one insurance company as a captive agent, he realized that he could better serve his client base by becoming an independent agent, representing multiple insurance companies and offering his potential clients more options and benefits choices. Educating the client on the plan options and benefits allows each person to become empowered to make decisions for what is best for themselves because Mr. Bowman truly believes that knowledge is power. He knows from experience there is no single health plan that works best for everyone. So he continues to educate others on the health plans that are tailored for each individual's needs. He is a licensed insurance agent certified to sell and market for several insurance companies. He has worked in various insurance capacities, including underwriting, eligibility determination, risk management, contract management, and Medicare sales and marketing that enables him to have a well-rounded view of the insurance enrollment process. And of course, he hails from the highest of seven hills, the Florida Agricultural and Mechanical University. So he's already coming in with the mindset to go out and help and enrich his community. So with that being said, I would like to welcome back Mr. Timothy Bowman back to our Healthy Happy Hour. Thank you for joining us again.
And I would like to thank you, Mr. Ward, for the gracious invitation to return
Yes,
and
sir.
also for the gracious and absolutely wonderful professional introduction back to this wonderful podcast. And you guys do a fantastic job getting out the information to the community and just do a fantastic job supporting the community
Yes,
and
sir.
uplifting the community with education and information, which we all know that knowledge is power.
Yes, sir.
Knowledge truly is power.
Thank you.
And the purpose of what I would like to do today is bring about some education and clarity when it comes to Medicare. We are in our annual election period right now, and there are a lot of questions regarding Medicare, the different plans, plan benefits, and things like that. But I'm just going to go over some general information that would hopefully help those who are Medicare beneficiaries
Yeah.
make a wise decision when it comes to what is best for them when it comes to the selection of a plan, or should they just remain on original Medicare. But the decision is actually left up to them um, to make a informed decision of what's best
Okay.
for their behalf. So I'm going to give a presentation starting now, and I will go over elements of original Medicare as well as Medicare Advantage And at the end of the presentation, I'll be more than happy to answer any questions that those who are on the podcast may have.
All right.
And I'm bringing up the presentation right now.
Okay.
I hope everyone can see this guide that I have on the
Yes, sir.
screen right now. Okay, it says a simple guide to Medicare. And this is going over to be eligible for Medicare. You have to be a U.S. citizen or legal resident. Okay. You must also be 65 years of age, or you could be 65 and younger with a qualifying disability. You also will qualify for Medicare if you're diagnosed with end-stage renal disease or ALS. In other words, if you were on dialysis.
Okay.
Okay. You can also be automatically enrolled in Part A and Part B if you receive Social Security or railroad retirement benefits. You will receive your card in the mail automatically. You will not have to go down and apply for it. But generally speaking, those who turn 65, they need to contact Social Security Administration to apply for Medicare. It does not automatically come to you. You would actually have to call Social Security Administration. Now, upon turning 65, you would have a 7-month window, which we recognize as IEP, which is the initial enrollment period for Medicare. In other words, you would have 3 months prior to your 65th birthday, the month of your birthday, and 3 months after your birthday to make a decision regarding enrolling to a health plan.
Mm-hmm.
Okay. So take, for instance, if your birthday was, say, in January, say January of next year, you can actually make a decision to enroll into a plan in October.
Okay.
Yes, 3 months prior to your birth month.
Okay.
Okay. Now, after you become eligible for Medicare and you receive your card, one of the main decisions that you would need to make is how do you want to use your Medicare benefits? Now, as a person 65 with their red, white, and blue Medicare card, they're covered with Parts A, which is hospitalization, and Part B, which is medical coverage or doctor visits and outpatient care.
Mm-hmm.
The red, white, and blue covers 80% of your medical costs. The other 20% is the responsibility of the beneficiary.
Okay.
So individuals who are on Medicare, they would either choose to cover that other 20% by paying for and enrolling into a Medicare supplement plan, or they will enroll into a Medicare Advantage plan to receive those benefits and cut the cost. In most of the plans, Medicare Advantage plans, they also come with a Part D, which is a prescription drug plan. With original Medicare, a person would have to pay for that prescription drug plan out of pocket. Medicare supplement plans, also known as Medigap plans, help pay for out-of-pocket costs that's not covered by our original Medicare.
Okay.
Medicare Advantage plans combines Part A and Part B, and as I stated, they often have a prescription drug plan, and many of the Medicare Advantage plans also include ancillary benefits like dental, vision, and hearing.
Okay.
And on this slide here, you can see Part A covers hospital stay and inpatient care. Part B, doctor visits and outpatient care. Part A is inpatient care. Part B is outpatient care. Part D is your prescription drug coverage. And Part C combines original Medicare A and B. And as I stated, most of those Part C Advantage plans, they include a prescription drug plan, and many of them have additional benefits like vision, dental, and hearing.
Okay.
Yes. Now, those who are on Medicare, they are definitely interested in costs. Like a lot of people are on fixed incomes. They're on their Social Security checks, so a lot of the incomes might not be very, very high incomes. So they are trying to cut costs and trying to get what they need medically without having to subject themselves to not getting medications because I can't afford it, and taking chances with the health care. You see this chart here, it goes over the cost you may pay with Medicare. There may be premiums, there may be deductibles,
Mm-hmm.
co-pays, as well as co-insurance. Now, the difference between these is the deductible is a set amount that you pay before your covered services begin with the plan. So if you had a deductible, for this example, say $500, you would have to pay the $500 before the plan will start paying the rest.
Okay.
A co-payment is a fixed amount that you pay each time you receive covered services. So you go to your primary care doctor, and before you leave, the receptionist tell you, Mr. Smith or Mr. Ward, your co-payment for today is $20.
Mm-hmm.
And that is the fixed amount that you will pay every time you go to the doctor's office for covered services.
Right.
And co-insurance is a percentage amount of the cost that you would pay. So instead of paying the copay at $20 per visit, you will pay a percentage, which for this example is 20% every time you would go to your medical provider for covered services. For low income individuals who also have few assets, they may qualify for one or more of the following programs. The first program is Medicaid. Medicaid provides health care coverage for people and families with limited income. Medicaid is funded through the federal government as well as state government. It may offer some services not covered by Medicare. Each state creates its own program, so a person would need to call the state Medicaid office for more information. And here in the state of Florida, they will call Access.
Okay.
Access, yes, for any questions regarding Medicaid. Now, there's also an extra help program, and this helps individuals for Part D premiums, individuals who would like to lower their prescription drug costs. It also helps with deductibles and copays. And the program is called Extra Help. And they will contact Social Security Administration for help with their Part D premiums and deductibles and copays. It's another place you call Social Security Administration.
Okay.
The Medicare Savings Program helps pay some or all of Part A and Part B premiums, deductibles, and co-insurance. You automatically qualify for Extra Help program if you qualify for the Medical Savings Program. So The prior program, extra help, if you qualify that, you will automatically qualify for the Medicare Savings Program.
Okay.
We also have the PACE program, which is the program of all-inclusive care for the elderly. And this program combines medical, social, and long-term care services for frail elderly people who live in the community and not in a nursing home.
Okay.
This program is not available in all states, so you would need to find out if the PACE program is available in the state that you live in. The Part A coverage covers hospital stays and most of inpatient services. So the coverage will include semi-private rooms, hospital meals, skilled nursing services, an entire list of these particular items here: lab tests, x-rays, medical equipment, operating room and recovery room, as well as the hospice care for terminally ill. All these type services are covered under Medicare Part A. Medicare Part A, for most individuals, there's a zero premium per month. And that's based on if an individual have contributed to the Social Security system for at least 10 years or 40 quarters. Now, if they did not contribute to the Social Security system for at least 10 years or 40 quarters, then there would be an amount for Part A that they will have to pay depending on the number of quarters that they did contribute. It says here your premium may be higher if you don't sign up for Medicare when you are first eligible. Okay. Now the deductible, $1,484 per benefit year. The benefit period begins the day you are admitted to the hospital and end when you are out of the hospital 60 days in a row. This is referring to hospitalization. If you look under plus copays for hospital stays, when you initially go in the hospital, the days 0 through 60, you pay zero costs. Now, from days 61 through 90, it's $371. And from days 91 and above is $742. And that is per day under your Medicare Part A coverage. Skilled nursing is $0 from days 1 through 20, and 21 through 100 is $185.50.
Mm-hmm.
Okay. Now, moving on to Part B, which covers medical and outpatient care. This is where you have coverage for your doctor visits, including if you had to go into the hospital, your annual wellness visits, ambulatory surgical center services, ambulance and emergency room services, skilled nursing, durable medical equipment if you need wheelchair or walkers. All of these things are covered under Medicare Part B. And there is a deductible associated with Medicare Part B. The yearly deductible is $203 per year. The premium, $148.50, and it could go as high as $504.90.
Mm-hmm.
Now, the Part B premium is a monthly premium that is either deducted from the beneficiary's monthly Social Security benefit check, or that they can pay it directly to Medicare. The amount that a person will pay varies depending on the tax reported income from the last 2 years. So they base that on the income tax statements that an individual has filed over the last 2 years, and the premium varies between a low of $148.50 to a high of $504.90.
Okay.
Okay, and then say you may pay less if you enroll in Part B in 2020 or earlier, and your premium payments are deducted from your Social Security check. You may pay more if you pay an income-related monthly adjusted amount if your reported income from 2019 was above 88,000 for individuals or 176,000 for couples. So it all depends on what you file for your taxes over the last 2 years. That would determine what your Medicare Part B premium would be. Now, when you enroll in original Medicare Part A and Part B on time, you do it on time to avoid late enrollment penalties, and there are penalties associated with both Part A and Part B. If you must pay a Part B premium and enroll late, you could pay a penalty, and the penalty will be 10% of the premium. And the premium, and the late payment penalty will be based on the number of months as well as the premium amount to calculate that 10% late enrollment penalty. And for Part B, there's a 10% penalty as well for late enrollment into Part B. And that's 10% of the monthly premium amount. And that's for each 12-month period enrollment is delayed. So for this example here, it's showing you there was a 3-year delay. Multiply that time 10%, you're talking about a 30% penalty. And that is a penalty that do not go away. It's a permanent penalty that an individual would be responsible for not applying for Medicare Part A and Part B when they were eligible to apply.
Okay.
Okay, now under original Medicare Part A and Part B, they do not cover everything. Sometimes individuals with their red, white, and blue card, they've been told a lot of things that's not factual when it comes to what that red, white, and blue card, Medicare card, original Medicare, that's what it is, original Medicare. It does not cover everything. Take, for instance, most care outside the United States, if you had that red, white, and blue card, it would not cover medical services if you need them. It does not cover eye exams, eyeglasses, or contacts, hearing exams or hearing aids, dental exams, cleanings, x-rays, or routine dental care. The red, white, and blue card does not cover prescription drugs or wellness benefits. It does not cover long-term care. Does not cover days if you had to go into a psychiatric hospital. It does not cover custodial care. Personal expenses, if you were in the hospital, if you wanted to watch a television or you needed make phone calls, it does not cover any of those additional benefits. And it does not cover hospital days beyond the set limits.
Right.
So individuals need to be very, very aware of what original Medicare will and will not cover when they are making the decisions about whether they want to stay on original Medicare or do they want to enroll into a Medicare supplement or a Medicare Advantage plan for additional coverage as well as additional benefits. Now, the Medicare Advantage plan, which is Part C, this plan combines Part A and Part B and also offers additional benefits. They are offered through private insurance companies approved by Medicare. And in addition to Part A and Part B, you notice here it covers, most of the plans will have a Part D prescription drug coverage. They cover hearing exams and hearing aids, dental exams, cleanings, x-rays, and routine dental care, eye exams, eyeglasses, or contact lenses. And most of these plans now have a wellness benefit, such as gym membership. The benefits may vary by plan and could include other extra benefits such as transportation to medical appointments
Okay.
and virtual visits, which is very, very popular right now, especially
Exactly.
during a pandemic. The beneficiary do not have to go to the doctor's office, but can receive vital medical information over the telephone or through the computer. And that is absolutely something very popular right now, especially during these times. The Medicare Advantage plans cost vary by plan provider. They are often premium free. In other words, that if you roll into a Medicare Advantage plan, most of the plans on a monthly basis, the premiums are at $0, and they can still provide these. The Medicare Advantage plans are required to set an out-of-pocket maximum, which is the total amount you may pay for covered services during the plan period, usually a calendar year. Now, original Medicare do not have a maximum out-of-pocket maximum. In other words, under the red, white, and blue card, if you were to incur, let's take for instance, a medical bill or cost for surgery, and the total amount of the surgery was $100,000, Medicare will cover 80% of that 100,000, and you would be responsible for the 20%, which would be, in this example, $20,000. Well, one good thing about these Medicare Advantage plans is they have a maximum out-of-pocket limit, and for 2021, it is $7,550. But there are many plans right now where that maximum out of pocket is much lower than this amount here, $7,500. There are some plans that are lower than $5,000 maximum out of pocket. And this is cost savings to the beneficiary because they will never have to worry about becoming financially ruined by a surgery or medical costs in the tens of thousands of dollars. They will always have a ceiling on the amount that they are responsible for. But with original Medicare, the red, white, and blue card, you're responsible for 20% of whatever that total is, even if it was hundreds of thousands of dollars, you will be responsible for that financial burden.
Okay.
Now, Medicare Advantage coverage and costs will vary from plan to plan by location and plan provider. The plans are they are several types of plans that are available according to your area. You have HMO plans, which are health maintenance organization plans, and these plans, they work through a network, and they require you to seek care from providers in your network and choose a primary care provider who may then manage any care you receive from specialists. When you choose a doctor within the HMO network, there are no extra costs outside of, there are no extra costs when you go in network and use those doctors. There are normally additional costs if you decide that you wanted to go outside of the network.
Okay.
Now, under the HMO plans, they may require you to get a referral for specialty services if you need to see a specialist. Now, the point of service plans, the POS plans, these are a type of HMO plans that let you see doctors and hospitals outside of the plan network for some covered services. Now, out of network may result in higher co-pays or co-insurance, but that would be on the beneficiary's responsibility. If he or she wanted to go out of network, they had to see this particular specialist. Well, they will be incurring additional costs when they go out of network. As long as they want to pay those costs, they are more than welcome to do so. Now, as far as referrals under the POS, point of service plans, they may or may not be required to get a referrals for specialty services. That it all depends on the doctor or the plan that they are enrolling in, whether they would need a referral. And we also have the PPO plans, which are the preferred provider organizations. Now, this network of doctors and hospitals, they have a provider network where you can use and offer more freedom because you can choose your doctors and other providers outside the network for all covered services. So this is not like an HMO where you had to stay in network. You can actually use doctors out of network locally,
Okay.
as well as take, for instance, here in the state of Florida, you can use doctors in another county, nearby county, or distant county. And those doctors will still, as long as the doctors are accepting the plan, you can still see those doctors out of network. Now, out of network care may result in higher copays and co-insurance under the PPO plans as well. But one thing about PPO plans, they do not require you to get a referral to see specialty doctors or specialty services. And that PPO plan is very good for those who travel a lot. I'm finding that it's very portable, and it helps those who travel because they may run into a medical situation where they need to see a doctor in Miami or Jacksonville, Tampa, or Orlando, and they want those services without having to break the bank to see those doctors. So they will still be covered with the PPO plan because it's portable and it provides them medical coverage and protection. We also have the private fee for services, PFFS. And typically, you may see any provider in the United States who accept Medicare and the plan payment terms and conditions. Now, the plan payment plan terms and conditions are established between the plan and the providers. And if the provider accepts those terms and conditions, you will be able to go see those providers under those terms and conditions. Now, the plan design vary in their coverage and costs. The referrals is not required under the PFFS plan design. The next type of plans that are available are special need plans, and these are designed for people with special health care needs and usually have plan-specific eligibility requirements. Take, for instance, the dual eligible special need plans, which are DSNPs or DSNPS. They are for individuals who have both Medicare and Medicaid. We also have CSNPs, which are chronic special need plans. And this is for individuals, people with severe or disabling chronic conditions. We also have ISNPs, which are institutional special need plans. That's for people who live in contracted special nursing facilities. And we also have IESNP plans, which are institutional equivalent special need plans. And this is for people who live in contracted assisted living facility and need the same kind of care as those who live in a skilled nursing facility. And we also have the medical savings account plans, which are MSA. And these plans combine a high deductible health plan with a special savings account. And what that means is the funds received from Medicare are deposited into a savings account and may be withdrawn tax-free to pay for qualified healthcare expenses. Under this MSA plan structure, they do not include a prescription drug plan. So if you were to select an MSA plan structure, you would also have to purchase individual prescription drug coverage for your medications. Now, Part D represents prescription drugs. They provide coverage for all of the prescription drugs and some vaccines. The drugs most commonly prescribed by Medicare beneficiary are determined by federal standards. Specific brand drugs and generic drugs include the plan formulary, which is a list of covered drugs. Now, under the prescription drug coverage, the medication costs are based on a formulary list. And by that formulary, the medications are put into a tier system, basically from tier 1 to tier 5. The lower tiers are your inexpensive medications, which are generic and preferred generic. And as you go up in value to prescription drug 5, you're talking about specialty medication and brand name medications, which are a bit more expensive. We live in a time right now where most of the doctors, if you ask them if you're on a very expensive medication, and if there is a generic equivalent, you can lower your medication costs by getting that generic or preferred generic brand. You can get prescription drug coverage through a private insurance company in two ways. You can either purchase a standalone Part D plan out of pocket, or you can enroll into a Medicare Advantage plan that includes a prescription drug coverage. And as I stated, these prescription drug coverage plans are added to the plan, and most of these Medicare Advantage plans have a zero monthly premium. Okay. Plan D costs vary by plan and provider. You have a premium. The standalone Part D plan charges a premium, and the amount will vary based on the plan and the provider. The plan may also have the deductible, and the plan Part D or Medicare Advantage may charge a deductible. Others don't. Plan may also have the copay, which is generally required each time you fill a prescription for a covered drug, and a co-insurance. Some plans may also set co-insurance rate for certain drugs or drug tiers. And as I was stating, the tiers would be from 1 all the way up to 5. And here we see the example here. Your drug costs may vary by the plan drug tiers from tier 1 to tier 5. And you notice from tier 1 to tier 5, they increase in cost for the medications. And it's showing you here, during the year when a person is on Medicare, they may go through different drug coverage stages. And there's actually 4 different stages that a person on Medicare with the drug coverage will go through starting in January and throughout the year. The stages are annual deductible. And during that stage, you pay for your drugs until you reach your planned deductible, or whatever that deductible may be. You continue to pay on your medications until you reach that deductible. The second stage is the initial coverage stage, which means you pay a copay or co-insurance, and your plan pays the rest. Okay, you pay a copay or co-insurance, and your plan will pay the rest for your medications. If you reach the coverage gap, which is also known as the donut hole, you will pay 25% of the cost for both brand name and generic drugs in 2021.
Right.
A lot of individuals do not reach that amount because you're talking about reaching $6,550 in 2021. But normally, individuals who are taking medication probably will reach, well, they're going to definitely have the annual deductible, and most will probably reach the initial coverage. But not often are individuals reaching the coverage gap or the last phase, which is catastrophe coverage. And that means you pay a small copay, a co-insurance amount for every medication that you're on for the rest of the plan year.
Gotcha.
Yes. And I was just talking about the coverage gap, which is also
Mm-hmm.
known as the donut hole.
Mm-hmm.
It sees here, it says that the coverage gap opens when you and your plan have paid up to a certain limit for your drugs in 1 year. When you're in this stage, you pay a bigger share of the cost for your prescriptions than before. You will exit the coverage gap only when the total amount you and others on your behalf have paid for your drugs reaching a set limit. The limits to enter and exit the coverage gap are set by Medicare, as well as what counts toward reaching the limits, and both can change each year.
Gotcha.
So, yes. So that is something that
That's
not
interesting.
not many people reach the coverage gap, but if they do, that is something that you definitely want to keep in
Mm-hmm. You need to
remindance
know.
of, that you're paying 25% of brand name drugs, and I'm sure a lot of individuals would not want to be paying, because brand name drugs are very expensive right
Yes,
now.
they are. Yes,
Yes,
they are.
yes, and 25% could really be expensive to your pocket as well.
That's a huge increase.
Yes, it is. Yes, it is. Now, with the Part D enrollment, there's also a penalty if you do not, once you become eligible for Medicare, um, enroll yourself into a plan that has Part D coverage, or you purchase a Part D coverage when you become eligible for Medicare. And that late enrollment penalty is 1% of the premium. And if you see this example here, it says that the Part D premium is an additional 1% of the average Part D premium for each month you delay enrollment. So this is based on the number of months that you delay. In this example, a person delayed 18 months before purchasing a Part D premium. They multiply the months times the 1%, and their monthly penalty is going to be 18 months times 1% is 18% of a monthly uh, penalty that they're going to be responsible for. And that penalty is not going away.
Right.
This penalty is not going away. Now, if an individual is they had, let's say, take for instance, they turned 65 and they're still working, or they're covered with credible drug coverage right now, so they're not they're saying to themselves, I don't need Part D right now because I'm still covered through my employer, and my employer is offering me the type of health coverage that covers my medication. So they wouldn't be subjected to this penalty, because as you read here, it says you may have to pay a Part D late enrollment penalty if either of the followings are true. You didn't enroll into a prescription drug coverage when initially eligible for Medicare, and you didn't have other credible drug coverage to qualify for enrollment during a special enrollment period. You didn't enroll into a prescription drug coverage within 63 days of losing your prescription drug coverage. So, usually from an employer health plan. So, in other words, if you were still enrolled, well, excuse me, if you were still working for an employer and you had credible drug coverage, this penalty would not apply to you. But if you left the employer and say you're approaching 63 days after losing your credible coverage, if it was after 63 days, then you will be penalized. But if you enrolled into a prescription drug coverage within those 63 days, you would not be penalized because you had credible coverage.
Right.
Okay. Medigap, once again, that's Medicare supplement insurance. It helps those who have Medicare Part A and Part B. It helps pay for some of the out-of-pocket costs not covered by Part A and Part B. Now, these could include Part A hospital co-insurance, Part B co-insurance or co-pays, cost of blood transfusions, cost of 365 extra hospital days, hospice care. Some
That's
may
good.
even, yes, absolutely. Now, some may also help pay for Part A deductible, Part B deductible, cost of foreign travel emergency care up to plan limits, and Part A skilled nursing facilities care co-insurance as well. Now, the Medigap plans, they set their own premium costs. The Medigap plans, they set their own premium costs as a general rule. The more generous the coverage, the higher the premium. In other words, if they're going to be covering more things, you already know that you're going to have to pay a higher premium for all these things that you want them to cover.
Right.
Premiums will vary. They will vary by provider, even if the plan letter is the same, and premium amounts can change year to year. Now, different plans pay different costs. The plans are based on letters, and if you were to go and Google Medigap plans, you'll see plans F, G, N. They all are alphabets. I'm sorry, they're
Mhm.
alphabets that these plans are designed under, and the plan benefits are designated. Some plans split certain costs with you to set limits. Other leave certain costs for you to pay on your own. So some will say, if you pay this, we'll pay that. Others say, well, no, you pay all of that, and we won't pay that particular type service. So you would really have to do your homework when it comes to Medigap plans, which are supplemental plans. They're not the same thing as Medicare Advantage plans. They are separate. These plans, you have to pay a premium monthly uh, for these type benefits and services. These are not Medicare Advantage plans like zero premiums. There are no Medigap supplemental plans that have a zero premium plan. You have to pay for these additional benefits that you want them to cover. Medigap insurers may make value added services available either free or on a discounted basis. Now, these type services, they talk about discount on vision, hearing, and dental, but we're not talking free services. You're gonna have to pay for these things. 24-hour nurse phone lines. They might throw in a free or a discount gym membership, but all in all, there will be a charge on a monthly basis for you to have that type of coverage.
Okay.
Medigap plans are offered by private insurance companies, and they are standardized by the federal government. Benefits covered Part A, hospital co-insurance and 365 days hospital stay. Part A deductible, Part B co-insurance or copay, Part B annual deductible, and also Part B excess charges if there are any additional charges that's not covered through Part A and Part B deductibles and co-insurance. If there are any excess charges, the Medigap plan could cover those as well. The cost of blood transfusion, foreign travel, hospice care, all of these are things that the Medigap or Medicare supplement plan could cover. And as I was stating to you about the plans are under alphabets, and this is a chart that shows you somewhat what these plans look like from A, it goes all the way to N, and it's telling you what percentage of coverage that these individual plans will cover under certain medical uh, uh, conditions that you may have. Not all these plans are going to cover 100%. If you look at this chart now, the one of the most popular plans out there right now is Plan F,
Exactly.
Plan G, and Plan N. You see they have a double star to
Yep.
the right of the F plan,
Yes.
and the reason for that is the F plan is a plan only for those who were born before January 1st of 1955. If you weren't born before that date, that plan is not available to anyone right now. But this just give you an idea of what percentage that these individual plans will cover for certain medical conditions and services that you're seeking, some more than others, depending on what your medical condition is. You will look at this plan chart and make a determination of what you really need coverage for the most and choose the plan according to what your particular needs are. Now, the question always come up, is the Medicare Advantage or the Medicare Gap plan is right for you? That question comes up quite often. And what you really need to do is look at several things when it comes to making that decision. The enrollment, what you're enrolling into, and what costs may be involved with the enrollment, the costs themselves when it comes to out-of-pocket costs, co-payment, co-insurance, deductibles, okay, and also prescription drug coverage. Do the plan that you enroll in, will it covers your medications? Also the network. Are you interested in a network where you have to see doctors and providers within the network, or would you like to go outside of the network? Are your doctors in town, in the city, or do you travel to see a specialist or whatever? Doctors in hospitals. Maybe you have certain doctors you want to keep as your primary care and specialist, and you do not want to change doctors. Hospitals, you're more familiar and you would like to be in a certain hospital as opposed to being assigned to a hospital. And referrals. Some individuals have a problem with the referral system. They want to go where they want to go, when they want to go. Other individuals do not mind working within network and having a referral from their primary care doctor to the specialist. So all of these are questions that you would need to ask yourself when making the decision on what is best for you. Is the Medicare Advantage plan good for you, and the best plan that structure is best for you, or is the Medigap plan is the right decision for you? But we provide information to help you along the way in making your decision, and I'm here to assist those who may have additional questions. And at the end, I'll put up my bios with my telephone number, and individuals be more than welcome to give me a call. I'll be more than happy to help them. Now, this chart is a comparison right here telling you between Medicare Advantage and Medicare Supplement plans, which are Medigap. Showing you to the left here, you can enroll into a Medicare Advantage plan during your initial enrollment period and Medicare annual enrollment period. If you meet certain criteria, you can enroll or switch to a different plan during the Medicare Advantage open enrollment period or special enrollment period. Now, we're right now in our annual enrollment period, which started October 15th and it goes to December 7th. So that means anyone who's on original Medicare that red, white, and blue card, Part A and Part B, who wish to enroll into a Medicare Advantage plan to receive additional benefits like Medicare Part D, prescription drug coverage, as well as additional benefits like dental, vision, hearing, over the counter supplies, as well as free gym membership. And also, we have plans that you may be able to receive additional give back money toward your Social Security check if you qualify for it. So that's the period that we're in right now. The OEP, open enrollment period, starts January 1st and it goes to March 31st. During that time, you're able to change your plan from Medicare Advantage to original Medicare. So you can make changes during that time from January 1st to March 31st. Okay. Now, under Medicare Advantage, generally you pay a low or zero monthly plan premium. The prescription drug coverage is included in the plans. You may have a network from which to choose your provider. So if you need a doctor, you can choose directly from the plan because they have a network of doctors. Sometimes individuals don't know where to go to find a doctor, but it's good to know if you had a network of doctors, you can contact the plan network and find a doctor or be assisted with finding a doctor. Under the Medicare Advantage plan, you may be required to use doctors at hospitals within the plan network. Take for instance, like the HMO design, which is health maintenance organizations. They encourage their members to use doctors in network versus out of network. And you may or may not need a referral to see specialists when it comes to Medicare Advantage plan. Now, on the other side here, we have, oops, hold on just one moment, I'm sorry. On the other side, we had the Medicare supplement plans, which are the Medigap plans. And it says here you can get a Medicare plan after you are 65 years of old or older and have enrolled in both Part A and Part B. You can apply to buy a plan at any time. However, you do have a 6-month Medicare supplement open enrollment period that begins after you are 65. In other words, when you turn 65, you have 6 months to make a determination if you want to enroll into a Medicare supplement plan or the Medigap plan. You have 6 months to make that determination. Okay. Now, if you enroll during this time, you are guaranteed coverage at the best available rate, regardless of your health status. If you enroll within that 6-month period of time, you got a guaranteed coverage at the best available rate, regardless of your health status. Now, outside of that time, your pre-existing health conditions may influence your eligibility for the plan and how much you pay. So if you know that you have some conditions and you need medical help, but you're interested in the Medicare supplement plan, it will be to your advantage to make sure your enrollment is within that 6-month window. Because after that window, you're not guaranteed the coverage any longer, and your rate will be higher. You will have to pay a higher rate for that Medicare supplement outside of 6 months. Now, with the Medicare supplement, you pay a monthly plan premium in addition to your Part B premium. When you use the services, your out-of-pocket costs are limited, but by how much varies by the Medigap plan that you choose. In other words, Medigap is going to be paying for out-of-pocket costs. Depending on the plan you choose from that plan chart that I just showed you that had the alphabets, it will make a determination of how much out-of-pocket costs will be based on the plan that you chose to enroll in. Some plans, your out-of-pocket costs, say the co-insurance may be 20% or 10% or 5%, but it all depends on what plan you decide to choose and enroll in and pay the monthly premium for that coverage.
Mhm.
The prescription drug coverage is not included with a Medicare supplement plan. Please keep that in mind. A Medicare supplement plan does not cover prescription drug coverage. You would have to purchase a standalone Part D plan in addition to your Medicare supplement plan.
Gotcha.
Okay. Now, when it comes to traveling with the Medicare supplement plan, the coverage goes with you when you travel in the United States, and it may cover emergency care when traveling abroad. Medicare plans themselves do not have a network, so you can go to any doctors that accept the Medicare supplement plan. You can select any doctors or hospitals as long as they accept Medicare patients. If the doctors or hospitals accept Medicare, they will accept your Medicare supplement plan as well. You can see specialists without referrals under the Medigap or Medicare supplement plans. As long as the doctors accept the plan and the plan benefits, you can go there.
Okay.
Now, here with options. You have many options when it comes to your Medicare coverage, and you have to decide, how do you begin to narrow your choices down? How do you decide which is right for you? You know, these are questions that you have to ask yourself. Now, answering these questions can feel can help you feel more confident when shopping for a Medicare plan. Generally, how often do you visit your doctor? That's going to be important. What prescription medications do you take and how often? Do you have any major health conditions that you need special care for? What did you pay out of pocket for health care in the last 12 months? And what did you pay for prescription drugs? Do you want coverage for dental, vision, hearing services or items? And do you need help paying for Medicare? These are all some questions that only you as the beneficiary can answer, but this would also help in your determining what decision you would like to make regarding Medicare Advantage and Medicare supplement plans. Now, here is an overview of the different times you can enroll. I went over the IEP, which is the initial enrollment period.
Mhm.
And that gives you a 7-month window. You can choose to enroll 3 months prior to your 65th birthday. You can choose the month of your birthday, or 3 months prior to 3 months after your birthday. So your 7-month IEP includes the month you receive your 25th disability check, the 3 months before and 3 months after when it comes to disability. So this is the IEP, the general election period, also known as open enrollment period. This is from January 1st to March 31st. Coverage will begin on July 1st if you make a decision within this period from January to March 31st. And you may enroll into a Medicare Advantage plan or prescription drug plan from April 1st to June 30th of that same year. And this is exactly what the chart is showing you here for the general election period, which is from January 1st to March 31st. Now, the SEP is the special election period, and this is when the individuals can enroll under certain specific circumstances that are determined by CMS, which is the Center for Medicare and Medicaid Services. If you plan to work past 65 or have employer health coverage through a spouse, you have options. This goes right here. If an employer has 20 or more employees, you can choose to delay your Medicare enrollment, drop your employer coverage for Medicare, or have both Medicare and employer coverage. If an employer has fewer than 20 employees, generally you will need to enroll into Medicare during your initial or enrollment period, which is IEP. If you have coverage through a spouse employer, you may be able to delay or you may need to enroll at age 65, depending on your employer. So when a person is still working and they're 65 or older, you really need to contact your employer to find out if you have credible coverage before you decide to enroll into a Medicare plan. Because if you already have medical credible coverage and the employer has more than 20 or more employees, you can choose to delay your Medicare enrollment. That's exactly what number one is saying here. But if the employer has fewer than 20 employees, you may need to enroll into Medicare during the initial enrollment period. Yeah, the only way you'll be able to check out find out if you have credible coverage is contacting your employer HR department and ask them about the type of coverage that you have and find out if it's credible coverage
Right.
according to the guidelines of Medicare.
But taking advantage of that open enrollment period is vital.
Yes, sir. Absolutely. Taking advantage of the open enrollment period is vital because you will have your coverage
Mhm.
on time according to Medicare guidelines, and you will avoid any penalties that's associated with you not enrolling on time.
Right.
Yes, sir. Now, I explained to you about the SEP, special enrollment period, and the only way enrollments can be done during this time, it has to meet some events happening in your life that CMS recognize as qualifying life events. And it states here you have 2 months after the month of a qualifying event to make plan changes. During this time, you may join, change, or drop a Medicare Advantage or Part D prescription drug plan outside of Medicare annual enrollment period without penalty. Now, that is we're in our annual enrollment period, October 15th to December 7th. December 8th is the special enrollment period.
Mhm.
So if a person had moved from Tampa to Tallahassee, Florida, and the plan that they were on in Tampa is not here in Tallahassee, Florida, they will qualify for a SEP so that they can change their plan to plans that are locally here in Tallahassee. That's what the SEP is for, qualifying life events for an individual to make changes so that they will be covered by a plan that is locally here where they live. Okay. And some of the common events may include moving, leaving retiree, union, or COBRA coverage. Those will be classified as qualifying life events where an individual could put in a SEP to change their plan to a plan that's available to them in the county or city that they're living in. Okay, as I stated, doing AEP, you can change, switch, or drop, okay, a Medicare Advantage or Part D drug plan. Okay, you can also apply for a Medicare supplement insurance plan. and that's between October 15th and December 7th. The Medicare Advantage open enrollment OEP dates are January 1st to March 31st. And you can switch or drop Medicare Advantage plans during that time. Okay, original Medicare. You have Part A and Part B. Part A is hospitalization. Part B is medical, which is doctor visits and outpatient care. You also can have Part A and Part D if you were on Medicare and you purchase a standalone prescription drug plan. So you could do that as well. Your other option is Part A and Part B, and you decide to enroll and add Medigap. You can enroll into a Medigap plan for extra coverage to your original Medicare. And you also can have Part A and Part B with Part D plus the Medigap plan as well.
Okay.
Those are the options that individuals have when they are on Medicare. Now, with the Medicare Advantage plan, individual cannot be enrolled into Medicare Advantage and Medigap, or the Medigap plan at the same time. They would have to be in one of the other, but they cannot be in both. It's absolutely against the law for them to be enrolled into both Medigap and Medicare Advantage at the same time. A Medicare Advantage plan, there are some plans without a prescription drug coverage. Most of them have a prescription drug coverage, as you see here. Part C is Medicare Advantage. It has no prescription drug coverage included. Most of the plans are Part C and Part D, Medicare Advantage plan with the built-in drug coverage. And you can also have a Medicare Advantage with a standalone Medicare. So that means you enrolled into a Medicare Advantage plan and you decide to purchase a standalone drug coverage plan. Okay, now this example here is showing you some costs related to individual who who's paying his monthly Part B premium. And in this particular plan, he has a Part C Medicare Advantage plan with a premium of $34. And he has prescription drug copay at $15. So it's basically showing you what his monthly base cost would be for Medicare Part B. It's Part C premium if he had one. And like I said, a lot of the Medicare Part C Advantage plans, a lot of those plans are zero monthly premium. So, but this example is showing if there was a premium, but not all plans are going to show a Part C with a monthly premium. And the $15 prescription copay. So he's looking at $197.50. Now, his plan is also going to include preventive care, fitness program. It says a built-in prescription drug coverage that's going to cover most of his costs and keep his costs down low, a network of local doctors and hospital, and is also going to have a maximum out-of-pocket for him for this particular example, $3,500. So he will never have to worry about incurring any outrageous medical costs beyond $3,500 because any dollar amount above that is covered by the plan. And right here at the bottom, it says his out-of-pocket costs may include co-pays, co-insurance, and deductibles. His total spending will vary depending on the specific cost sharing terms of his plan, the healthcare services he used, the prescriptions he fills, and whether the services or items were obtained in network or out of network. Because David's plan has an out of pocket maximum of $3,500 for the year, once his out of pocket costs for covered services reach that number, his Medicare Advantage plan will be responsible for the rest. So no matter what the dollar amount above $3,500, his plan is responsible for the rest. I don't care if it's 200, 500,000. It's peace of mind to know that no matter what you go into the hospital for, what surgeries or specialists you have to see, your out-of-pocket costs will not be above this maximum. For this example, $3,500, no matter what the hospital is billing, you will only be responsible for that maximum out-of-pocket. And that is definitely a big difference between enrolling into a Medicare Advantage plan and remaining on original Medicare, because original Medicare has no maximum out-of-pocket limits. You are responsible for 20% of your medical costs, regardless of what the dollar value is. That responsibility is definitely yours. So you definitely want to keep that in mind, especially if you're an individual who requires a lot of medical attention, have had surgeries in the past. You might need them in the future. This is definitely something to think about when it comes to financial responsibility and also indebtedness. Yes. So on this example is showing original Medicare with a standalone Part D plan and a Medigap plan. So showing right here, the person is still going to pay Part B premium. You're going to pay the Part D, which is the prescription drug plan. But now, because they have the Medigap plan, there's a monthly amount that they have to pay for that Medigap plan, which is $150. And then they have a prescription copay. So this is what an example of an individual incorporating Medicare with a Medigap plan, what their monthly fee might be by incorporating that Medigap plan.
Okay.
Now, this is a good example of original Medicare with a standalone Part D plan premium prescription drug plan. Okay, she still paying the Part B premium, $148.50. Okay, the Part D premium for the medications, $34, and then the copay when she goes to pick her medications up. So this is what an example will look like for the person who's on the red, white, and blue card with the original Medicare, and also covered with a standalone Part D prescription drug plan. This is an example of what the dollar amount could be. Now, I'm sure you know these are examples. It could vary. It could be higher. It could be lower. But this is just an example. Here we have another example of original Medicare with Medigap N plan. Okay, once again, monthly cost $148.50. That's the standard Part B premium that everyone is paying, and $190 for the Medigap plan. So you see what he's doing here. He still have access to doctors and hospitals throughout the United States, and this help with costs not paid by original Medicare. That's the reason why he's purchasing the Medigap plan, showing that his yearly out-of-pocket limit is $2,940. Below 75% of benefits are paid at 100%. So he's got a out-of-pocket limit of under $3,000. So, but he had to purchase that Medigap plan to bring that maximum out-of-pocket down low, so he would never have to incur any outrageous medical costs.
Right.
So these are really some great examples for individuals to look at when you trying to determine what's best for you in your medical situation. Now, here's a lady, Karen, and the only thing she has is original Medicare, and she's paying her Part B premium. So if she had to go to the hospital or she incurred some major medical costs, Medicare will pay 80%, but Karen is responsible for 20%, and she do not have a prescription drug coverage. So if she don't make a determination and a selection of a Part D prescription drug coverage, she's going to be penalized.
Right.
Yeah, she's going to be penalized 1% per month. Okay, now here is an example of a person that has special health needs, and showing right here special health needs for people with diabetes. Okay, and as an example of a special health need, and this has a built-in prescription drug coverage. So this individual will still pay the 148.50 for the Part B premium, but the person is enrolled into a Medicare Advantage plan that has special needs, and it has a premium associated with that particular plan. So the premium is $24, and you see what the base total per month, 172.50. Now this person who's enrolled into the special need plan, they're going to have access to a care manager who will create a plan to coordinate their care. They will have help in finding out if they qualify for financial assistance with Medicare costs. They will receive discounted prices on the drugs they take, and they will be given help when adopting to a healthier lifestyle. So this is more of a hands-on when a person has special health needs. This enrollment into a special needs plan is a more of a hands-on and follow-up. They really are involved with trying to help individuals who have serious health problems. This particular individual says he suffered from diabetes and high blood pressure, and his doctor has told him he needs to lose a considerable amount of weight. He takes insulin and blood pressure medication every day. He has had trouble in the past with interactions with the drugs he is taking. So he has a lot of things going on here, and the special need plan are designed to address individuals with special health needs. So individuals who are in this category, they normally qualify for Medicaid. If they're not on Medicaid, they're normally encouraged to apply for Medicaid because of their medical condition. And that's the reason why they will receive a lot of these additional benefits, because they will be dual eligible, covered with both Medicare and Medicaid. Now we have Medicare quick tips. There are two ways to get Medicare: original Medicare Part A and Part B. Okay, that's provided by the federal government. The benefit and coverage are the same across the country. Original Medicare can also have a standalone Part B prescription drug plan or a Medicare supplement insurance plan. Medicare Part C, which is Medicare Advantage, these plans combine Part A and Part B coverage. Many also have Part D prescription drug coverage and other benefits such as hearing, vision, dental, or fitness benefits. The plans are offered by private insurance companies. There are two ways to get drug coverage: either standalone prescription drug plans, which are Part D, that you can add to original Medicare, and you will purchase that plan out of pocket. Or you can enroll into a Medicare Advantage plan that includes a prescription drug coverage, And most of these Medicare Advantage plan with the prescription drug coverage, a lot of them or most have a zero monthly premium. So the plan is added, the prescription drug plan is added to these particular plans. Now, original Medicare, as I stated, they do not cover everything with the red, white, and blue card. They cover your Part A, which is hospitalization, and Part B, which is your medical, but they do not include prescription drug coverage, hearing, dental, vision, wellness services, or financial protection. Original Medicare will not cover you financially if you're responsible for 20% of all your medical costs. If you want additional coverage, you may want to explore some plans provided by private insurance companies, such as Medicare Advantage, as well as Medicare Supplement plans. Okay, Medicare Advantage plans and prescription drug plans vary in terms of coverage and cost. The insurance companies may offer several plans where you live. Medicare Supplement Insurance Medigap plans are standardized and are the same nationwide, except in Minnesota, Wisconsin, and Massachusetts. Now, calculating your Medicare costs, you are responsible for monthly premiums plus additional out-of-pocket costs such as deductibles, co-pays, and co-insurance. Your costs will vary depending on the Medicare coverage you choose, the health services you use during the year, and if you have any financial assistance from for Medicare costs. Financial assistance could come through local programs, Medicaid, or any type of other service that helps with Medicare costs. Protection from high out-of-pocket costs is available. Medicare Advantage plans put a cap on your out-of-pocket costs for Part A and Part B services covered by the plan. It's called the annual out-of-pocket maximum, and it provides built-in financial protection. There's no out-of-pocket cap with original Medicare. Total out-of-pocket costs and financial protection may vary for in-network and out-of-network costs. Medicare supplement insurance plans help pay some out-of-pocket costs not paid by original Medicare, like deductibles and co-insurance. A variety of plans are available that offer different levels of financial protection. So the Medicare supplement plans can provide financial protection as long as you pay your monthly premium for the plan. Medigap plans are organized by letters, such as Plan A and Plan G. Both Medicare Advantage and Medicare Supplement insurance plans are offered by private insurance companies. You can either choose a Medicare Advantage plan or a Medicare Supplement plan, but you cannot choose to enroll in both. As I stated earlier about timing matters when you first enroll. You're given an opportunity. We are in our annual enrollment period right now to make a decision if you want to enroll into a Medicare Advantage plan between October 15th and December 7th, where when you turn 65, you have your IEP, which is your initial enrollment period, which is a 7-month window for you to make a decision of enrolling. And that's the time, if you want to enroll into a plan, you should make a decision to do so. Tips for Medicare annual enrollment period. You should evaluate your overall healthcare needs, especially if your health has changed in the last year. This will help you make a determination of whether you should stay on original Medicare enroll into a Medicare Advantage plan or select to enroll into a Medicare supplement plan, but you need to evaluate your overall healthcare needs. You also need to review your existing Medicare coverage to evaluate how it fits your healthcare and your lifestyle needs. Individuals' lifestyle and healthcare needs can change from year to year, and sometimes it can change from month to month. So you need to make a selection of what's best for you right now, as far as your needs are concerned, and make that determination. Now, you should also review your Medicare plan annual notice of change letter that they send out yearly, usually in September, to identify important plan changes to cover benefits, providers, costs, and prescription drugs. This is something that you need to uh, definitely put this in most important documents. They come out every year, usually in September, to identify you with any kind of changes to your plan, benefits, providers, and costs and prescription drugs. And this is important information that you would need to know. You would hate to go to the pharmacy or to your doctor next year and find out that that medication is no longer covered at zero cost. Now it's $125, or to go to your doctor and find out that he's no longer in the network. So this annual notice of change letter is vital. It should be put with your most important document, so you'll know what's going on for the upcoming year.
Just want
Now,
to give you, I'm sorry, just want to give you a heads up. I got to be at the staff meeting in about 15, 20 minutes. Just give you that
okay,
heads up.
okay, I'm gonna go ahead and move toward closing.
Okay.
Thank you for that heads up. I know it's a
No
lot of
problem.
information. I'm trying to
No
get through it.
problem.
Yes, sir. You also want to evaluate your current healthcare needs and healthcare costs to decide if your current coverage is still a good fit or if you should shop around and make any type of changes. You should also explore available Medicare plan options in your area to see if something may be a better fit for you or for your health and for your finances. Keep in mind that these plan benefits, they change um, pretty much from year to year. There might be additional benefits that's added to certain plans that you are unaware of. So be open to change, because change could be good. It could be something that could help you when it comes to your health and your overall well-being. Okay. Okay. Now, regarding low income and few assets, you may qualify for help through one or more programs. You can contact Medicaid is a good place to start. Contact your state Medicaid office. You can also contact Medicare savings programs for assistance. Extra help is available for those who need extra help with their prescription drugs, as well as their premiums, deductibles, copay, and co-insurance, and also PACE, a program for all-inclusive care for elderly. You can contact these particular companies and departments to see if you qualify for additional help. You can also visit Medicare.gov to learn more about financial assistance programs.
Okay.
On this page is a list of helpful contacts that you can call. The Medicare helpline is 1-800-Medicare. Social Security Administration, 1-800-772-1213. AARP, if you wanted to call them, 1-855-581-8090. General information regarding Medicare, you can go to the website, medicare.gov. And also, you might want to contact your state health insurance assistance program, which is SHIP, SHIP. That will be another site for information regarding helping you find additional help regarding Medicare and maybe financial assistance.
Okay.
Okay. Now, pretty much covered all the uh, major things I wanted to go over regarding original Medicare and Medicare Advantage. We also have some common Medicare questions and answers, but I open the panel up to anyone who would like to ask me any questions right now. I'm here to be of assistance to you, being that I'm an independent licensed insurance broker agent. I'm here not representing one company. I'm representing several insurance companies and carriers. And what I look for is to provide the best plan that's for you, whether it's a Medicare Advantage plan or a Medicare Supplement plan. I'm here to assist Medicare beneficiaries with the enrollment into the plan that's best suited for them and their healthcare needs,
Okay.
as opposed to working for one company and only able to enroll you or talk to you about one plan and one product or service. I represent multiple companies and carriers. So the decision to enroll into a plan is left up to you. And I would just tell you what's available to you in the selection of the plan and try to see what's best for you when it comes to your healthcare needs. That is my job, and that's what I enjoy doing. And I enjoy educating and empowering people so that they can get through this Medicare information. It's a lot of information, and my job is to take information that might be seemingly complex and simplify it so that individuals can understand it. It's been a pleasure having me
Yes, sir.
on, Mr. Ward. Any questions? I'm here to answer them.
All right. I think you did a thorough job of covering this information, because I really can't think of one question that all the questions that I know I had, you covered. So this was a very comprehensive presentation that really that hit all the points, really. Yes,
Well,
sir.
thank you, sir. Thank you. It was
No
a
problem.
pleasure. It was
Yes, sir.
truly a pleasure being here. And whenever you want me to come back to go over any areas of Medicare, healthcare, I'm here for you. I definitely want to see the neighborhood medical centers do very well. They are instrumental in helping people throughout our community. You guys do a fantastic job, and I take my hat off to you, each and every one of you dedicated employees who working very hard to provide the services to the community.
We thank you very much for all the work that you've given to our community over the years, all the knowledge and expertise that you have working in health insurance, and being able to break down a presentation like this for our viewers to give them a greater understanding of what the healthcare system is, especially when we're talking about Medicare and the difference between Medicare and Medicaid. Because I just found out the difference between Medicare and Medicaid this week myself. So you're giving people a lot more comprehensive information that they can digest and actually use, and it's given to them in a way that they can understand it and repeat. So we definitely thank you for stopping by, being our guest for this edition of Healthy Happy Hour.
Absolutely, and feel free to share my bio
Yes, sir.
on the at the toward the end, because I'm still in sharing and I don't want to mess anything up. But you feel free to share my bio with all of your guests.
Oh,
And
yes.
if they have any questions or concerns, they can feel free to give me a direct call. I'll be more than happy to schedule an appointment and go over any concerns that they may have.
Oh yeah, so yeah, and we're gonna make sure your contact. Yeah, I'm gonna attach some to this video, but your contact information will also be in the bio, and the contact information is in the description of this video. So when it goes out, and everybody be able to see it, so they're gonna be able to contact you. Y'all make sure y'all contact Mr. Bowman. Any questions, anything you have, and like we say, this is Healthy Happy Hour, and this is how we do it. So appreciate everybody. Appreciate you, Mr. Bowman, and we will see you guys next time on Healthy Happy Hour.
Thank you, sir. It's been an honor, Mr. Ward. You have a great day, sir, and I'll let you get to your meeting.
Yes, sir. You have a great day as well.
Thank you, sir.